by having a person read a standardized vision stimulus, such as an eye chart, at a distance of 10 or 20 feet. Once you've greeted the child and completed observation for any vision problems, you're ready to have the child's practice reading the chart. The purpose of the practice is to ensure that the child can read the chart and to ensure the child understands the game. Children who wear glasses are screened with their glasses on. The screening proceeds more smoothly if the classroom teacher teaches the game to the children in advance. Provide the teacher with practice cards of the symbols or letters selected so the children are familiar with matching the shapes or letters on the day of the screening. The helper in the waiting area may also practice with the children so that the screening game is fresh in their minds. The screener explains the symbols to be used and makes sure that the child knows how to play the game. Have the child stand at the appropriate distance with heels on the line. Children who use a wheelchair or other chair due to a physical limitation are seated with the back and head even with the line. Make sure children who normally wear glasses have them on. Direct the recorder to note it on the recording form. Have the child read a few symbols on the top line of the chart using both eyes. If the child is having difficulty, move the child closer to the chart to determine if he understands the instructions and can play the game. Move the child back when the responses are correct. The chart attendant indicates the symbol to be read by placing the tip of the pointer directly below each symbol. Both the chart attendant and the recorder should watch for signs of vision problems. Screen the right eye first by covering the left eye with the occluder. The screener should hold the occluder to ensure proper coverage. Watch that the child does not peek around or tilt his head to see the chart. Tell the child it is okay to keep both eyes open. Do not push on the child's eye with the occluder. The chart attendant should point to the symbol on the outside of the top line. The screener asks the child to identify each symbol as the chart attendant points to them. The screener should face the chart while testing so that the child is not distracted. However, the chart attendant may periodically turn to make sure that the child's eye is properly occluded. Determine whether the child is responding properly and inform the chart attendant accordingly. It may be necessary for the screener to repeat the child's answer to cue the chart attendant to move to the next symbol. The screener and chart attendant may establish a neutral code word to indicate an incorrect response. Work down the outside of the chart showing one symbol or letter on each line until reaching the critical line. Screen down to the critical passing line if possible. Go across the critical line, asking the child to identify each symbol or letter on the line. If the child is unable to identify one more than half the symbols on the critical line, move up the chart until you find the lowest line at which the child is able to correctly identify one more than half the symbols or letters. The chart attendant follows the instruction of the screener. It is the responsibility of the screener to decide if the child is responding correctly and to instruct the chart attendant to continue moving down the chart or across the line. Inform the recorder of the smallest line that the child passed. During the screening, the recorder should be watching for proper occlusion and for signs of vision problems. Repeat the screening procedure for the left eye. There are two possible initial outcomes of the acuity screening. The child passes and proceeds to stereopsis testing, or the child fails and must be re-screened at a later time. If the child cannot pass the critical line in either eye, he or she is re-screened at a later time. It is best to re-screen at a later date when the child might perform better. But since that is not always possible or practical, re-screen later that day. After the re-screening, the child either passes and proceeds to stereopsis testing or fails the screening and is referred to an eye care professional for a complete eye examination. The critical or passing line for children 5 years old and younger is the 2032 line. Children age 5 and younger are referred if unable to pass the 2032 line, either with one or both eyes when rescreened. The purpose of the stereopsis test is to determine if the eyes are working together. When the brain is able to blend the separate images from each eye into one image, the child can perceive three-dimensional space and is said to have stereopsis or binocular vision. In the child whose eyes are not working together, the brain is unable to blend the separate images from each eye. A child who fails the stereopsis test is at great risk for amblyopia, or loss of vision in one eye. He or she should be seen by an eye doctor for a comprehensive examination. The screening test is required for children through 3rd grade or age 9. There are various stereopsis testing tools. Prevent Blindness America's Pediatric Advisory Committee recommends the Random.E Stereopsis Test Kit. It is commonly called the RDE. The RDE test kit includes 2 cards with random dot patterns, one of which contains a 3-dimensional picture or stereogram of the letter E. While wearing polarized glasses, a stereogram is visible to individuals with stereopsis, but not visible to those without binocular vision. Using the 2 test cards and polarized glasses, the child is asked to identify the card with the E. The stereopsis test is only necessary for children who pass the visual acuity screening. However, since children enjoy the magic glasses game, many screeners test every child regardless of the acuity results. There are 4 basic steps to the RDE stereopsis screening: setting up the screening area, prepare the child, conduct the stereopsis screening, and interpret stereopsis screening results. Set up in an area with normal room lighting away from windows where glare or bright light can be a distraction. Avoid setting up in an area where shadows or inadequate lighting may be of concern. Place a chair for the screener. The screener sits while the child stands facing the chair to bring the screener to the child's eye level, as required for proper testing. Place the RDE test kit and alcohol swabs on a table near the screener's chair. Set a wastebasket nearby for easy disposal of alcohol swabs. Mark the floor at 5 feet from the screener's chair. Mark the floor where the chair should be placed just in case the chair gets moved. Place happy feet with the heels at the 5-foot mark. Proper placement of the glasses on the child's face is important for accurate testing. If the child wears glasses, place the polarized glasses over the child's glasses. Do not remove the child's glasses for the stereopsis test. To preserve the lenses, avoid touching the lens surface. Only the screener should handle the glasses. Do not let the children put the glasses on themselves. Use a soft cloth lightly dampened with mild soap water to clean the lenses. No other cleaners may be used on the polarized lenses. Do not submerge or overly water the lenses, as it will destroy the lens material. Discard polarized glasses from which a lens may have fallen out. Don't attempt to place the lens in the frame yourself, since the polarization angle is critical to accurate testing. To prepare the child, first show the Model E card to the child, explaining that he might see a picture that looks like that on one of the cards when he has the magic glasses on. If the child is reluctant to put the glasses on, explain that they are special sunglasses, magic glasses, or some other playful name to help the child feel comfortable. Some screeners put the glasses on the teacher or themselves to encourage participation. Have the child stand on the happy magic feet. To conduct stereopsis screening, place the child at the proper testing distance with the polarized glasses in place. Make sure that the glasses don't tilt to one side or slide down the child's nose. Improper position